just doesn't seem feasible that the vaccine would stop being effective within just a few weeks after a single dose. We know that after a single dose, you get about 90% of people who are ill enough to be admitted to hospital being stopped from getting that ill. So it's 90% effective at preventing serious illness. And we know from other vaccines that that's far from unusual. Most vaccines are better at preventing serious illness than at preventing minor illness. Right now, we have a crisis in our health services. Across the world, we're seeing the health services being swamped by people being admitted to hospital with COVID-19 disease. We need to stop that as fast as we possibly can, giving them a single dose of vaccine in the first instance, and then getting as many people having one dose of vaccine is the best way of doing that. If we want to give everybody two doses, if you give 100 people one dose of vaccine, you'll prevent 90 of the people who would otherwise have been admitted to hospital from being admitted. If you give the same 100 doses to 50 people and give them two doses, you'll prevent 95 people from being admitted to hospital who would otherwise have been, sorry, not half of that, half of 95. So you've only given it to half as many people. So it's less than 50%. At the moment, the priority is stopping people getting admitted to hospital. We know that that immunity does not fall away so quickly. We've got quite a lot of evidence now for COVID-19 even, that natural disease seems to give you protection for 6 to 8 months. So it really doesn't seem at all likely that the vaccine stopped being effective. We have to be pragmatic. We have to use what we know from other vaccines to decide to work that way.
That said, there are still community concerns about the delay to the second dose. Do you think it is a priority then for the pharmaceutical companies to be conducting trials with a longer delay between the first and second dose just to reassure the public?
I think the horse is out of the stable on that one. Certainly in the UK, the Public Health England is doing exactly that. They published their surveillance strategy for vaccination a couple of days ago, before I wrote my article, and it's very clear that they will be looking at precisely that, at the effectiveness of a single dose of vaccine and the effectiveness of two doses, looking at different intervals between the doses. So it's probably too late for the manufacturers to be leading on that now, and how it's down to post-marketing or post-implementation surveillance by the authorities in the UK and the States and everywhere else in the world.
Peter, the media has been sort of tying their knickers in their twist about Boris Johnson and his bicycle, and then comments from Number 10 about not much demand for vaccines after 8 o'clock in the evening. It all just seems nonsense to me. I mean, shouldn't we be pushing towards some form of 24-hour vaccination program? If the vaccine is available, why aren't we injecting people?
As I understand it, at the moment in the UK, the bottleneck is still vaccine supply. We hope that will change, that we believe that there's going to be a lot more vaccine becoming available. We also think a lot more of it will be the AstraZeneca vaccine, which is a lot easier to distribute because of the lack of the ultra cold minus 60 to minus 80 storage. And the fact you have to use the vaccine within 5 days when you thaw it. But while the bottleneck is the amount of vaccine, then there doesn't seem to be much point in opening at night, because you just use up the available stores of vaccine quicker and run out. So for the time being, I don't see the need for doing it overnight. It may well be true that you wouldn't get that many people who are prepared to come out at 3 o'clock in the morning to get vaccinated. If I were offered it, but only at 3 in the morning, I'd be there like a shot and say thank you very much. But I don't know. We've never trialled that before. It hasn't become an issue yet because we don't have enough vaccine to do that, as I understand it yet.